Welcome to Atp Live Monday. Oh, I think my internet is acting up a little bit today. Yeah. All right, we'll see how it goes today. Let me just. All right, so let's share the video first. All right. Okay, I just hope you can see me and hear me. The internet is just acting weird. Just let me know in comment section. I will also try and pin the video. All right. Good evening. Welcome everyone to ATP Live Monday. We'll see how we can manage today. It's a little bit, uh, a little bit of technical issues today, but I'll see what I can do. Um, and I'm also just going to pin the videos. Okay. All right. I think it's a little bit better now. All right. So, good evening. Welcome to ATP Live Monday. I am Gemi Salaba. Today, and this program is brought to you by Ask Pediatricians to our Facebook group, and we'll try and answer them as well. So, thank All right, good evening. I have to go live on my phone now because my main internet is acting weird. Well, we'll see what I can do as well. But thank you so much for joining me. If my other internets are acting well, I will go off this one. All right. So thank you. Welcome. This is ATP Live Monday program brought to you by Ask the Pediatricians Foundation. ATP is committed to the health and the well-being of your children. And so we do that through our online program and our offline program. Okay, I think I can go off this one. Okay, I think I can go off this one. Okay, I think this is better, hopefully. So I can see that Piel has asked a question, and your question is: good evening, Doc. My daughter is 7 months old today, and at 3 months she was 6.6, and she was on exclusive breastfeeding. And since I started to introduce solid to, she doesn't accept any, either she cries or spit it out. I'm worried because the weight she's not gaining. So what is her current weight now? Because I think the weight you gave us was the weight when she was okay, at 6 months the weight is 6.6. Okay, I think I'll continue with my phone. I don't know what's going on with my home line. All right. So Chippell is asking about the weight of her child. Your baby was actually quite big at birth, 4.5. But I'm so curious, what was the weight of your baby before you start complementary feeding? Because your baby was 4.5 and at 6 months 6.6. So I mean, even though you just started complementary feeding, the question is what happened between 0 and 6 months when you were going for the immunization at 6 weeks, 10 weeks, 14 weeks. What were the weights of the baby? Because that is very helpful for us to know how your baby was doing. So it would be nice to know what that is, because even the weight of your baby at 6 months, 3 weeks, I really want to know what was the weight in between, because we know you just started complementary feeding, which is fine, but the baby's weight is quite unusual. I mean, that means your baby has only gained less than 2 kilos, yeah, about 2.1 kilos since the baby was born, and that is actually concerning on its own. Even when you are breastfeeding, your baby should have gained more than 2 kg. So I'm curious about what were the weights of this baby when you were going for your immunization at 6 weeks, 10 weeks, and 14 weeks, because that means your baby was not thriving all through that period. If your baby has only gained 2 kg, so I'm curious about that as well. So I want you to tell us what was the weight of your baby in between. Okay, so that is number one. Then number two, we can now start talking about the complementary feeding. But the weight of the baby is not just about the food we are just starting now. Even on breast milk, your baby should have gained more weight. Okay, and just like I'm happy you've seen your pediatrician. I don't know how you are doing your complementary feeding, so I don't know whether you are on our Facebook group, whether you've gone through all our guide section on complementary feeding. We have lots of information there on how to go about complementary feeding, so I'm going to recommend that you do that first. um okay, need to let me remove this one. Okay, I don't know whether it's better with without my phone. I'm just hoping my internet to be stable now. Okay, so I'm just going to recommend first that you uh, follow the principles on how you go about complementary feeding. All right. So when you're starting complementary, you have to start slowly, and then you try variety of food. you don't rush through and give it, you just started 1 month. So definitely you are seeing the early phase, and you maybe just need like 2 feeds of complementary feeds in one day. And then you can start even with just 1 spoon or 3 spoons, then you gradually build it up. You don't just see because you gave one and the baby doesn't take it that first day, that means the child is not going to take it again. You can cover it again. And when you first start, even if it's only 1 spoon or 2 spoons the child was able to take, that is still okay as well. So, but you gradually build it up. So, okay, you say you have gone through it, you have watched all the videos, and have you implemented the principles and strategies? So, because we recommend a lot of patience when doing that. So, as you're introducing things, number one, you have to offer the same food. Um, Over and over and over, we say up to 13 times before you can say you've given up on that. And then before you had another food. And of course, you are still breastfeeding. But like I said, I'm really worried that there's more going on with this baby than just the complementary feeding, because I'm just curious that the baby has only gained 2 kilos in 6 months. For the baby that was born 4.5, your baby was actually a very big baby. Your baby was actually what we call a macrosomic baby. Baby was any baby more than 4 kilos at birth is big. So you would have expected that even at 6 months, baby should be doubling their birth weight. So if the baby is still only having gained 2 kilos, and I'm just curious how that was not flagged all the time we're going for immunization, that should have been flagged. So when you go for 6 weeks immunization, somebody should have checked the weight that it has increased. Then you go for this 10 weeks, and you go for, so were they not checking and were they not having that comment about what's your baby's weight? Because I don't believe it's just this complementary feeding in the last 1 month that is making this baby not to have gained any weight at all. Even with just the breast milk alone, we expect more. So yeah, I'm definitely not comfortable. I'm not quite sure what your pediatrician why your pediatrician is very comfortable, because it's not just the absolute weight we're interested in, we're also interested in the pattern, the way the baby has been gaining weight over time. So I'm still going to recommend that you get to see the pediatrician again, and then maybe a dietitian as well. Sometimes the dietitians, they can work out the food for you and how you can help your baby with the complementary feeding. So yeah, that's what you need to do. But the same thing, there's nothing magical we're going to do about a child who is not eating. It's about making sure we're doing the right thing and trying the variety, and trying not to give the baby food in a very forceful manner. We don't want you to force feed the baby, but there's no way your baby will have no food at all that people will not take. Like every food you offer, the child will not take. I mean, that's very unlikely to happen. And obviously make sure that the food has taste, because some of us say, I'm giving my baby pap, no sugar, no nothing. It's bland, it's tasteless. That is not acceptable as well. Make sure the food has taste, make sure it's prepared properly. So, which is why I know you say you've gone through the video, but I want you to take note of those salient points, and then don't worry about the quantity at the beginning. First, you just make sure that you're feeding the baby. If it's just 1 spoon, let the baby take that one. Then gradually you can make it 3, 5. That's how we go ahead. And you keep on breastfeeding the baby at the same time as well. But this is a baby that really need your pediatrician to sit with you, maybe with a nutritionist as well, and really unpack what has been going on, because I'm more curious about what happened. You should have your immunization card, and I believe that each time you go for immunization, that baby was being weighed. And so if the baby was being weighed at every visit, what were the weights, and were everybody happy? Because I know most of us go for immunization and the nurses check the weight. Those things are not fulfilling all righteousness So it's not enough for us to weigh those my app My internet is acting up today. All right. So okay, I think I'm back now. Okay. You say where I am now, I don't have the card, but the weight's 6.3. Okay, if the weight was even 6.3 before, what was it before? You said 6.6. Be sick after the baby was born. Was there any problem? Was there a time the baby lost weight? Because that is also, which is why I said we really need to have all those background information. Like if something has happened, maybe in between now and 6 months, so maybe the baby may have lost some weight and all that. So I don't have all those information, but I'm sure your pediatrician will know more and will have all those information. But I don't want you to watch it. It's something that can be maybe at this point you may want to see a dietitian or nutritionist. They can also help you in terms of the food, the how you mix them, how you prepare them, so that's another thing that you may want to do as well. So um uh I don't know which parts where you stay, but I'm sure there are nutritionists in most of our general hospital, teaching hospitals, and there are a few of them that run private practice as well. So they may be also be able to help you. Though I felt that sometimes if you just patiently introduce really, really slow today. My phone is also eating up, so I'm on off as well. So, but I'll see what I can do. But if you are watching, if you have any question, feel free to post your questions. Today is one of those days, but we'll see how much we can do. And those on Instagram, welcome as well. If you have any question, post your questions. I can see my Instagram. Instagram is fine. I think I'm wondering whether the issue is actually StreamYard because my other apps are working fine. So maybe it's not my internet. Maybe it's actually StreamYard's issue. All right. Post your questions. I can see my Instagram. Okay. I don't have any question on Instagram. I don't have any question on Facebook as well. Um, I mean on the StreamYard. So I'm just going to continue with my phone. I think the my laptop is really not working properly. So just bear with me today. All right. So yeah, I think the issue is from StreamYard's end, not from my end. All right, because when I use my phone, it's working well. Okay, so uh, sorry, my apologies once again. It's not a very smooth one today, but we'll do what we can do. Okay, I hope you can hear me. All right, yeah, good. All right. And if you have questions, make sure if you're those who are watching in the group, make sure you post it on, you click on the video to ask your question, because if you ask your question in the Facebook group itself, I won't be able to see it, which I think some people do. Um, but let me just be sure people are not asking. Okay, I think they have, no, it's okay. That's fine. All right. Okay, let me just, I'm just going to share the video, okay, to other pages. If you are just joining, welcome to ATP Live Monday. Give me Boyde here, and I'm happy to answer any question you may have. If you're watching on Instagram, just drop your question directly under the video. If you're watching on YouTube, you can do the same. If you're watching on any of our Facebook groups, you have to click on the video so that you can put your questions directly under the video. Then that's when I'll be able to see your question and I'll be able to answer them. Okay, so that's what I'm doing right now. Um, all right, but I can't see any question to answer right now. Okay, oh, there's a question on Instagram. Amma say my 6-year-old still walks on tiptoes and it seems to be aching him now as he grows. What can I do to help him? Okay, yeah, it is really not appropriate that at 6 years old your baby is still tiptoe walking. So I really need you to see your pediatrician or at least a orthopedic surgeons, because we really need to know why the child is tiptoe walking. So most children, for those who are not conversant, tiptoe walking is when the children walks, they go on their toes. Normally children should walk with their feet flat on the floor, but if they walk on their toes, it's as if, when you want to pick something, you stand on your toes. That's how some children actually walk all through. And so that is always it could be a sign of many things. So that is why I say you have to see your pediatrician. We need to know why the child is tiptoe walking. All right, I think I'm posting my video right. So, and is your child otherwise okay, or is there any other health issues with the child? If there's no other health issues with the child, because we tend to see that also a lot in children who have autism. So, but if your child is talking, sociable, then I will not worry so much. But we need to know whether there's some neurological problems. There are other neurological problems that could make a child to be walking persistently on the tiptoes. So that is why you need to see either a pediatrician or an orthopedic surgeon so that we can examine the child, we can check for any signs of neurological problems, and then we will tell you what to do. And then sometimes we may need to do intervention. So like physiotherapists, sometimes they do a lot of what we call stretches, passive stretches. They can even make some kind of what we call orthosis, like a kind of a material that we can use, the child can wear inside their shoes to kind of stretch them out. We always recommend that you let them wear ankle boots, boots that they can force them to go flat, on the when walking. So these are some of the things you can do first. The physiotherapy can also help you with some exercises to massage and keep the feet flat. And then sometimes, if it is really bad, some children may actually need surgery. The surgery is to stretch out those tendons. But I think the most important thing is for us to know why first, to make sure there's no neurological problem or any other health issues that could make the child to be a persistent tiptoe, walker. And then after that, we can now talk of the practical stuff that will help the child to be able to walk well. All right. All right. So I hope, Amma Haman, I hope you were able to get that. All right. Thank you. Then I have another question from Instagram from Pri Shemilore. I hope I pronounced that right. Okay, please, can you talk about teaching in children? Yes, I can talk about teaching in children. Okay, Mahama, you got my answer. Thank you. I know I'm working in a different method today. So, okay, thank you for that feedback. All right, so let's go to talk about teaching. So teaching in children, teaching is a normal thing for children. When children are born, majority of them, they are born without any teeth. Okay, so that is normal for children not to have teeth. So of course, some children actually are born with teeth. So we have what we call neonatal teeth. So children are actually born with teeth, which can be very difficult, especially for breastfeeding. So sometimes we have to take it out if they are born, and because sometimes those teeth are loose, and so children can, in the process during breastfeeding, they can swallow the teeth if it comes out, if they come off. So because of that, we tend to remove teeth that babies are born with. It doesn't mean those babies are evil babies. It doesn't mean they have any what do you call them? They don't have any evil powers or anything. No, it's a normal phenomenon. All right. So, but that is but majority of children, when you give birth to them, they don't have any teeth. So, but by the age of 6 months, between 5 to 7 months, actually, they can begin to bring out their teeth. Okay. And we call that is what people talk about teething. So that's the first set of teeth that children will have. We call them milk teeth, primary teeth, or temporary teeth, because the babies they are still going to lose those ones. So those primary sets of teeth, the children will have them up to the age of 5 years. Then by age of 6, 7 years again, those teeth will fall off, and then they'll be replaced by what we call the permanent teeth. So children tend to have, from the age of 5 to 7 months, they start bringing out their milk teeth or their primary teeth, and they will have 20 of them by the age of 2 years, 2.5. Then by the age of 6 to 7, or 5 to 7, they begin to bring out their permanent teeth. They will lose all the 20, and then they will have the 32 that we have we have as adults. So there are two forms of teething period, but I guess the one that tends to trouble parents are the first set of teeth coming out, when they start to come out. And because parents tend to think when the teeth are come out, there are a lot of beliefs and myths around it. And people think, oh, it makes the children sick, or it makes them to have diarrhea, it makes them to have fever, it makes them to have cough, it makes them to have this and that. And because of all these beliefs, which are not true, which are not factual, a lot of people have produced what they call teething mixtures. They call them teething drugs, which ideally we should not give to our children, because the children do not need any drugs, because teething is normal. So it's just like saying walking, it's just like saying children growing up, it's just like saying children talking. These are normal developments for children. These are things that children would do normally on their own. And a lot of mothers that follow us on ATP, most of them have told me when they've got this kind of information and they really remove their mindset from blaming everything on teething, they found out that they just wake up and find the teeth in the children's mouth, and nothing. You don't have to do anything. So teething is something children will do. Teething is not the cause of fever, it's not the cause of rashes, it's not the cause of diarrhea, it's not the cause of anything. What are the signs when children want to bring out it? Sometimes they may, they have a little bit of itchy gum, they may, be itching the gum, so either they put their mouth in the gum to scratch it, or they can pick up any toy, because that's around the age they start to sit, and that's around the age they start to explore the environment. So they pick up things and they put it in their mouth. They can sometimes bring a little bit of drooling, like saliva. They can salivate a little bit more, or they may feel this urge to bite. So when they're breastfeeding, they can sometimes bite on your nipples and all that. So those are some of the common signs of teething in babies. But otherwise, some babies don't give you any sign. You just wake up and you find the teeth in their mouth. So they don't need to give you any sign at all. So when children are sick, let's not assume it's because they are bringing out their teeth. And because of that, by virtue of what I've said, that teething is a normal thing, teething does not cause any illness in children. Children do not need any drugs at all, either before, during, or after they start bringing out the teeth. They don't need any drugs. So all your so-called teething mixture, teething powders, your all those things people give, what they give them again, I'm trying to remember the names. So all those things, but you know their names. Please do not give children, okay? Do not give your children any of those so-called teething mixtures, because they are not necessary, and some of them, they can cause more problems for the children. So please, baby Rex, Burna Babe, all those other things, please, children do not need any of those things. So teething is normal. If a child is having fever, if a child is sick, do not assume teething. I've always said, if I get a naira or $1 for every time mothers ask me whether this particular symptom is because of teething, I'll be a multimillionaire in dollars or in naira, depending on which one I'm collecting, because people just always assume that is mother's experience, mother's number one diagnosis. Any little thing, oh, it's teething. And child is having diarrhea, it's teething. Child is having fever, it's teething. Child is having cough, it's teething. What is it? Teething is an innocent bystander. Okay. I know there are many reasons why children can have issues around this age. There are a lot of things that go on at the age of 6 months when children start to bring out their teeth. Number one, that is the time most mothers stop exclusive breastfeeding. So this is the time mothers start to give their babies other food. So, and of course, we know that sometimes people don't get it right. Hygiene is an issue with the water, the food. So sometimes babies are prone to diarrhea because of all the things people are not doing right. Actually, those who are bottle feeding, giving formula and all those stuff. Also, this is the time that babies are sitting and they begin to explore the environment. So if you don't pay attention to environmental hygiene, so children are playing with also, they can reach out to pick up things on the floor, and they are in what we call the sensory oromotor stage, where everything they pick up goes into the mouth. So they pick up a lot of dirt and put in their mouth. So definitely that can predispose them to germs and infection. Also, this is the time that the antibodies, so when babies are born, mothers, you pass a lot of antibodies to your babies, which protects them. And also, if you are exclusive breastfeeding, you also see pass a lot of antibodies to your baby through your breast milk. These are good source, immunity for the baby. So they protect the baby against a lot of infections. But around that age of 6 months, most of those antibodies that your baby got from you, they start to wane off. Kind of, their quantity in the blood would drop off. So at that point, the baby's immunity is also at risk because the baby's mother's antibodies are now waning off, and the child has to start making their own antibodies. So again, this is another reason why children around this age are prone to infection. But because it's also that same time that babies are breaking out their teeth, so a lot of people just assume, oh, it is the teething that is causing the diarrhea, that is causing the fever. It is not the teething. Okay, so what you need to do, pay attention to hygiene. All the toys that the babies are putting in their mouth, let's make sure we wash them. Let's make sure we sterilize them. Let's pay attention to hygiene. Wash your hands. Make sure before you prepare the food, when you change the diaper, you're washing your hands constantly. Be mindful of the environment. Environmental hygiene is very important. Actually, in our culture, people just believe that baby should play with sand. They should put sand in their mouth. They should play with dirt. That's how they will become strong. No, that is not true. That is not absolutely not true. Please keep your baby's environment clean. Keep their toys clean. Sterilize them. Don't bottle feed your children. Give them the food with cup and plate so that you can wash it and dry it properly. And make sure you wash your hands. Make sure the water that you give them to drink are boiled. So if you do all those things, most children will be fine. And I'm happy that a lot of people on ATP do tell us that because of this knowledge they now have, they actually found that their children don't have any problem with it. They just wake up, they find the teeth because people just assume it is teething that is causing problem. But if you know that it's not teething and you pay more attention to things that can cause the problem, then the children will be fine. So if your child is sick, having fever, give them paracetamol. Don't give them any baby Rex or any so-called teething mixture. If the child is not better, take the child to the hospital. Don't assume teething. The reason why I'm really emphasizing this, because as a pediatrician, this is one of the problems we have. You see children coming to us very sick, very, very sick. And we are like, this child has been sick for 1 week, has been sick for 2 weeks. Mommy, where have you been? Why are you just coming now? I mean, pediatricians, we are not magicians. We only treat, we're only doctors. We are not magicians. We can't do miracles. We can only manage. So, and the earlier you come to us, the better. So, and then the number one reason mothers always tell us why they've not brought the child to the hospital is because somebody has told them, oh, it is teething. And they told them, be giving the teething mixture. And so the mother relaxed, thinking, oh, it's just teething. I'm already giving teething mixture. It's going to pass. And then it's when the children are almost dying, then they come to the pediatrician, and the pediatrician is expected to do a miracle. So please don't ever make, I always tell mothers, don't make any diagnosis of teething. A child is sick, a child is sick. It is not teething. Bring the child to us and let us know what is wrong and let us deal with it. So I hope that is helpful for pre-Shemilore. I hope you are still online. Okay, thank you. I'll stop on teaching there, but if you still have anything to clarify on teaching, feel free to ask. I got a question on Facebook from Anita Jonas. Say, good evening, Doc. What can I add to my baby's pap to make it more nutritious? Apart from the corn, millets, and guinea corn, my baby is not accepting pap at all. Okay, thank you, Anita. Okay, I want to start from the other hand by saying that it is not compulsory for your baby to take pap. I don't know why we Nigerians especially, we believe that the first complementary food the baby should take is pap. It's almost as if that's the only food children should take for complementary. Baby doesn't even have to take pap at all. It is not written in the constitution. So it's not compulsory for the baby to take pap. My phone is eating up. I hope it doesn't go off. It doesn't die off on me. All right, so that's why it's a little bit noisy because I'm putting my fan on it. All right, so it is not compulsory for your baby to eat pap. Okay, there are so many other food your baby can eat. Okay, pap is just a carbohydrate. It's just one of the carbohydrates food, so it's not compulsory. Rice is also carbohydrate. Your yam, vegetable, your potato. These are other alternatives. So it is not pap. And that's why we also want to give our children pap 24/7, pap every day. It is not necessary. It's not compulsory at all. So for the foremost, just forget about pap. If your baby doesn't like pap, give the baby other things. You can make porridge with your rice. You can make porridge with your vegetable. You can make porridge with your potato. You can make porridge with your rice. You can make porridge with your vegetable. You can make porridge with your rice. Okay. Sorry, I have to switch on to another device. All right. So, for going back to Anita's question, so it is not compulsory for babies to take pap at all. Let's just get that one out of the picture. But it's okay if you want to give your baby pap, okay? But it is just not compulsory because I see a lot of mothers worry so much about their children not taking pap. If your child wants to take amala, want to take semo, give that. If baby want to eat rice, baby want to eat porridge, give that. It's not necessary for baby to eat cereals at all. It is not the only way children can eat. Okay, so that's just one thing I like to for clarify. But what are the things you can add to your pap? You can break egg into it raw and cook it together. You can put your crayfish, you can put your granules, you can put all those kind of even some of these fruits. You can put all those things in your pap to make it more nutritious. So those are things you can do. Another thing we should need to know about pap is that your pap should not be watery. It should be thick. It's supposed to be thick porridge. So for example, if you if you put a spoon of your pap and you turn it over, it should not pour. If it's pouring, then that means it's too watery. Okay, so the pap should be thick. It should not go through a bottle. It should only go through with spoon and cup. Okay, and make sure it's tasty. So put a little bit of sugar or dates or even your formula, something to sweeten it, because most time why babies don't like those pap is that we make them watery. We don't add anything to make it tasty, no sugar, no dates, no natural sweetness. And then you expect the baby to take it, and just be drinking it like milk. No, that's not appropriate. So make sure it's thick. Make sure you can add any of the protein, like even your soya bean or soya milk. You can add it. You can add your egg. You can add your crayfish. You can add your granules. Of course, you make them in powder. You can add a little bit of palm oil, and then you stir it together. You cook it all together. Then when it is cool, you can add a little bit of your breast milk or formula if you don't want to use your breast milk, and then make sure it has a little bit of sweetener, either natural sweetener like dates powder or your normal white sugar is fine. Just use it in moderate quantity. So those are the things you can do and please don't of giving a baby of food and not just the same food every day. So if you give pap in the morning today, follow with the draw soap, make sure you put a little bit of fish or chicken, you can do also those kind of things. So you can give your children boiled egg, you can give them okara. There are many things we can give our children using our local food. And that's why most time parents ask us for food timetable. I don't give food timetable ever to any mother. You will never see that on ATP. And the reason is because I want people to know the principle. What are the ingredients you're putting together for my baby? Then you can use that information to know what you're putting together for my baby. Then you can whatever you have in your own kitchen, you eat in your own kitchen. You can make don't need all of food. And there are lots of all these Instagram baby chefs. These are always putting a good mix of, or at least 4 out of the 6 classes of food must be present in your baby's diet. So make sure you put it together. that is the idea. That's the principle. It's a good mix. And oh, let me use my other phone now. Okay. All right. I think my internet is back. Okay. You are asking about the rice. I'm trying to post that as well. So there are different ways you can do your rice. You can cook your normal rice, cook it very soft. I don't know what is going on in our health centers today. When I was having my babies, then I remember that you can the food demonstration classes where you can actually see how you can make food for your baby. So I think maybe people are so busy now, so we don't tend to get some of those classes anymore. But really, that is the kind of things that we used to have in those days. So I hope our health centers and we'll go back to the good old days where our children can have the we can demonstrate to them how to mothers how to make food, and so I really wish, even like beans for example, you can peel your beans and cook it, like say if you want to make more money, but you boil it and cook it and then you mashed it, put a little bit of your crayfish and all that. Is lovely. Most children love it. You can put a little bit of butter, you can put all, so the goal is that you are conversant of all the different kind of food classes and you are able to actually put them together. So I really hope our primary health centers will start doing food demonstration for mothers again, so that they know how to prepare food. So you can boil your rice normally, and then but you cook it softer than the one you eat. Most of us we eat our rice, as grains. We like it not. I like, at least for myself, I don't like my rice much. But for the babies, actually, if your baby is like 6, 7 months, you want it very soft. You can match it so, and baby can eat that. Or there are people that have made rice powder, so they've already grind the rice into powder, and then you just cook it like the way you normally use your powder for your pap or any other thing. So there are many ways by which you can make the rice. But by the time your child is already getting to that 9, 10 months, they can start to uh, eat their own food as well. Okay, I think. Uh, Let me just take this one out. That was my laptop interfering. Okay. So I hope that is okay for you, Anita. So there are many ways. I would recommend you watch some of these videos by people who do all these recipes for babies' food. Some of the websites of nutritionists, you will get a lot more information. And if you go to health centers where they do food nutrition, food demonstration, they will also show you how to make all these simple recipes using our own local food, what you eat normally, what is available in your kitchen, and you can give your baby. Just experiment. Don't box yourself into a corner. Just experiment with variety. I hope that's helpful. All right. Let's go. I have another question on Facebook now. Udrak. I hope Udrak. She on stage. Okay. Udrak is saying, I took my boy of 1 year, 5 months to the health center. Malaria test was carried out, and afterward, malaria tablets and antibiotics was prescribed because he was having cough. So he finished the malaria tabs and the antibiotic will finish tomorrow. But the problem is that he's still running temperature. So when did you go to the health center? You didn't give us the time. So I always like to have a timeline because I want to know How long ago was that? And have you completed your anti-malaria treatment? Okay, so I personally don't believe in all these double treatments, So a child is very unlikely to have both the malaria and an infection at the same time. I mean, things are not always that hard, okay? So it's either the child has malaria or the child has an infection. The child does not have the two, okay? And so you didn't tell us the blood test results, so I don't know what they saw. But I assume that the malaria was positive, so that's why they gave the child anti-malaria. So sometimes I have my reservation about some of these our labs. Sometimes some of them they already know that it's like I don't even know whether some of them do the test and they're always writing 1+ malaria for everybody in Nigeria. So I don't know about that. So and the fact that a child has 1+ malaria does not necessarily mean the child has malaria, because most of us live in Nigeria. We will always have one little malaria parasite in our blood. Doesn't mean we have malaria. But the question is, if your child is still having fever, how high is the fever? I need to have that information. How many days have you taken the treatment? I need to have that information. But if I don't have that information, the generic answer I'm going to give you is to say you have to go back to the hospital. If you normally would say after 48, 72 hours of treatment, if your child is on treatment and after 48, 72 hours, the child is not better, I will recommend that you take the child to the hospital for what we call follow-up, so that the doctors can have a look at the child again, and then they can advise you on they may want to review their diagnosis, they may want to review their treatment, or maybe they just want to give the child a little bit of time to get better. It depends on how high the fever is. For example, if the fever is a low-grade fever, less than 38 or something, most likely it could be a viral infection. Most likely you don't even need any drugs in the first place. Most likely we just have to wait for the infection to run its course. But if the child is having high-grade fever like 38 and above, 39, I will be definitely worried. And that one, I want you to go back to the hospital quickly. And then number one is either the diagnosis is wrong, or the treatment is not working, or we have to do something different. So it depends. So there are many different things that can make a child not to get better even though they're on treatment. But also make sure you are giving the paracetamol and all that. But apart from the fever, is the child generally better? That's another thing. Is the cough better? Is the child more alert? Is the child more playful? So there are many other things doctors look at when we are trying to decide whether a child is getting better on treatment or not. So it is not just only the fever. So, but because you do not give me all those extra information, it's a little bit tricky for me to be able to give you more information. Okay, you said that you went there Wednesday last week. So the malaria treatment is completed. That's 5 days ago. Wednesday, yeah, I guess. Wednesday, it should be about 5 days ago. Fever of 38. For me, fever of 38 is most likely not the kind of fever that I would worry about. I would say put it under, most likely this child just have what we call a viral infection, because you said you had a cough and the child is having a fever of 38, so most likely it is not something I'm going to worry about. Okay. But I didn't see your child, so I'm only relying on the information you are giving me. So if for fever of 38, I would say just give the child paracetamol and monitor. You can go to the hospital if you go back to the doctors, if you're worried about it. But I'm just wondering whether your child actually needs to have been on any medication, whether the child is just having what would look like a viral infection that is just going to run its course and the child is better. But that also depends on how your child is. Is the child looking sick? Is the child better? Is the child eating, and all that? Yeah, if the child is active and playing, exactly. If the child is active, sorry, I wasn't showing you all your comments. I'm just the only one reading it for myself. If the child is active and playing, I strongly suspect, which is what I'm already saying. I strongly suspect that this child just have what look like a viral infection, and this child doesn't even need to have been on any medication, But of course, most mothers come to the hospital, and then you are worried. Sometimes doctors, depending on where you go, some people will just say, okay, let's just treat our common things. And that's why they gave both the anti-malaria and antibiotics. Most of the time, most of those medications are absolutely unnecessary. Sometimes, if it's in other parts of the world, they will do all those viral infection, and if it's viral, they are not going to treat your child. They're just going to, okay, give paracetamol. The child is going to get better on their own. So, and I worry a lot that we overtreat our children. We overtreat malaria. We overtreat infections. Most of the time, they are really not necessary. But it's okay. You can complete the antibiotics because you've started. You have to complete. And but I will not worry about it. I will just give the child paracetamol and just wait. It may take up to 2 weeks for a viral infection to run its course and go away. So, but I will not worry at all about it. So, from what you're saying, I'm not worried. If I have seen your child, most likely I will not be treating the child at all, apart from just giving paracetamol and other symptomatic treatment. And let the child drink a lot of water, because sometimes dehydration can make the children to have fever as well. Let them drink a lot of water, and that's it. All right. Thank you so much. Okay. I think my time is up. I really want to apologize for today. I've never had this kind of, it's been a while I had this kind of very serious technical issues with I don't know. I don't know whether it's my internet or whether it's StreamYard, but my laptop was just acting up, but I have to use my phone. So apologies for all the breaks back and forth. But thank you so much for those of you who were able to stay with me on Instagram, on Facebook, and on YouTube. Thank you so much. And if you have any questions still, remember that our Facebook group is open from Mondays to Saturday. So feel free to post your question on our Facebook group, and we'll try and answer them as soon as we can. We try to do it within 24, 48 hours, sometimes up to 72 hours. So that's our promise. We will try and answer your question. But of course, if your child is very sick, please bring them to us in the hospital. We don't want you to post questions about a child who should be in the hospital. A child is having an emergency. A child is breathing. I see a lot of videos of children who are breathing with so much difficulties. Breathing difficulty is hospital. Breathing difficulty is hospital. The child is unconscious. The child is bleeding. The child has had a fall, a fracture. Hospital. Those are hospitals. Those are not ATV. But if you want to ask about complementary feeding, you want to ask about immunization, those things that can wait. The child is otherwise well, or yes, you can leave that with us. We'll try and do it within 72 hours. But if a child is very sick, please bring them to us. Do not delay in seeking care. We pediatricians, we only care. We only do our best. This is God that heals. And the earlier you come to us, the better our chances. And children tend to go down very fast. Children can go from 100 to 0 very quickly. So we really want you to come to us when they are still not that bad, so that we can quickly do what we can, and God will help us to get them well as soon as possible. All right. So thank you, Udrak. Yes, you can give paracetamol. Don't worry. But like I said, if the fever should go to 39, or the child is looking more sick, of course, I know you are a very sensible mom. You will just take the child to the hospital. But if the child is playing, is eating well, playing and all that, just 38, just give paracetamol and just watch. But if the child starts to lie down, not doing anything, or what you look out for as a mom. Even if you are not comfortable anymore, just bring the child to us at the hospital. Thank you so much, everyone, and I will see you same time next week by the grace of God. Till then, have a wonderful, wonderful evening. And it is bye-bye for me. Bye.